And as cases rise, the state is detailing its plan to get booster shots into the arms.
And the hope is people will go to their doctor's office or even the pharmacy to get that third dose. And we're also told that those mass vaccine clinics could be set up if needed. Henry Graff with our vaccine team has details from the Virginia Department of Health downtown.
State health leaders say they have the capacity after running the numbers on who may need a booster shot, and a promise from the feds that there will be ample supply of COVID-19 vaccine when the time comes. Pending FDA approval, the state will move forward with booster shots starting the week of September 20th.
We're certainly in a much different circumstance than we were when the vaccine rollout first started.
How will this work? Well, first, the state is figuring out how it can notify you that it's your time for a booster, which will be 8 months after your last round of Pfizer or Moderna vaccines. Private providers like pharmacies will handle notifications their own way. Most healthcare workers and those in nursing home facilities will go first, solely because they were the first to get the shots as they became available earlier this year. Now, based off the numbers, the state estimates the largest crowd will need a booster in late December, about 320,000. The state says 2,700 providers should be able to handle those numbers without needing mass vaccine clinics. That's because those same providers helped inoculate around 500,000 people in the spring.
So as we go through, because it was graduated from when people got to their second dose, we'll not see a big wave of everyone needing their booster shot at the same time.
State health leaders say the sense of urgency and emergency is different heading into this part of the pandemic because we've been here before. If needed, Dr. Ovula says the state would be able to set up mass vaccine clinics if conditions warrant later this year.
It's a little bit of a different circumstance. Last year, we're in the circumstance where nobody had immunity, or some people had immunity through natural infection, but we weren't sure how long that lasted. And we had a small number of doses, whereas now
VDH says there's still no guidance on boosters for those who receive J&J vaccines, but the hope is that there will be more information in the coming weeks. Richmond Health also saying those who have a J&J shot in them to not seek out a booster shot of Pfizer or Moderna. The health department saying there is no recommendation yet from the CDC or FDA on that. On your side in Richmond, Henry Graff, NBC 12 News.